Hi, my name is Pat Thompson. I'm public health nurse for Marshall County, and this is the third segment every week, it seems like right now, because our topic is the COVID-19 or coronavirus. And it's someday that'll be easier to say, but I'm not sure when that will be. But I'm happy to be here today to talk to you about how to take care of yourself. And I know it's kind of a broken record because with public health, you know, we prevent, promote, and protect is what we do. And so it still needs to be said on how to take good care of yourself during this pandemic. Who knew it would be a pandemic? But it is. It's worldwide, and it's affecting every person in the world. It really is. So we see changes. We see, and they're subtle, but we see that there's going to be better things coming because of all the work that you are doing to have self-control and not go out and put yourself in your health in harm's way. I'm going to say it that way. We need to take good care of our health because we need to when we're healthy, we can help take care of other people in our household, and also we help take care of other people because we're not spreading any viruses or germs. So I heard on the TV today that there will be a new way of paying more attention to hand washing and realizing that when we even touch our face with our hands without washing them, that it spreads germs and viruses that way too. So that's one thing we want to talk about today is, you know, the same old, cover your cough, wash your hands, and stay home if you're sick. That is still the same advice that we have. You know, sometimes people don't know they're going to get sick, and you may have ventured to the grocery store or whatever. But as soon as you are ill at all, you do not leave your home. And you self-isolate yourself to get away from any other family members that are there because you can help them from getting sick too. We've had a little bit different guidance from the Iowa Department of Public Health, and we know it's going to be evolving. I'm glad we had some later cases because I'm sure they did more work than what I had to do taking care of people in the county. And so my work has been where I would call the case, a patient to me, a case, and I would do an interview. And the interview would really consist of, do you have any diagnosed medical conditions that such as diabetes or asthma or any heart disease, those types of things that we would just want to know about. And the other part of the investigation is have you traveled? And also your signs and symptoms, you know, your symptoms of what you have that led you to get care. Now, the only people I investigate are people who are confirmed, and that's okay because we don't have enough tests for one thing, and also the spread now is community spread, so that means that we don't know really where you got it. You know, if you are someone who has been ill with a respiratory illness and sometimes fever, sometimes not. I've done investigations and they all vary, but if you had a respiratory illness in particular, it's probably COVID-19 or coronavirus. And not everybody needs to be tested unless you are showing signs and symptoms that are more life-threatening and more than just moderate or mild. Then we would test for sure. And that's all kind of subjective, we know that. But anyway, we would test and then we would confirm that it was or wasn't. And first thing they do is actually test for flu. So going along the investigation sheet, I would ask you your signs and symptoms and ask you how far you are along or what your symptoms are at this time. Because, you know, the test is not immediate. We don't get immediate results. And sometimes people are kind of through their illness by the time I get the information to call them. And that's why when you're ill, even if you're not told to stay home and isolate yourself, do it anyway. That's what we really need to do. It's been a privilege to talk to people and help them through this illness type thing that they're going through and help them with understanding how to take care of themselves and their families. And one of the hardest part, I think, in what my job is that anybody that's living in the household needs to stay home and be isolated from the person who has a confirmed case, okay, confirmed COVID-19, because we want you to not be exposed anymore to that person there, and let you go 14 days to make sure that you don't get sick or ill again yourself, not again, but yourself, because then that means you can that you were not exposed or did not get it from the persons in the household. Generally, like I've tried to tell people, we wouldn't be pointing fingers. We don't point fingers that I got it from this person or that person or someone at work or wherever it may be, because it's maybe not true, and it's easy to do, isn't it? We know that, but you may not have gotten it from work, even if you were whoever you were exposed to, possibly. So anyway, I want people to just take good care of themselves. I keep saying that, but take good care of yourself. Work on, if you're sick, taking good care of yourself while you're sick. If you're not sick, like I say, stay home. And so that leads us into thinking, how do we tolerate, is kind of the word nowadays. Most people are doing a really, really good job at that. And how do you tolerate staying home all the time? So that's when you get to do your finding some activities that maybe you haven't been able to have the time for, and we see lots of like YouTube films, and the creativity is amazing to me. I really don't have that, so don't expect it soon. I would need lots of help to be a part of that, but it sure is fun to see what other people are doing. Also, get outside. Don't congregate. The social distancing is the key. Okay, social distancing is the key. Distancing is the key. So when you go outside, don't congregate. I know they use the term 10 people or less. 10's a lot of people out in a crowd, and 10 people. How do you stay at 6 feet away from 10 people? We just have to be honest about it. It's too hard. 4 is manageable, like a square. But it's just if you're out and about. Remember that 6 feet is the minimum, and the reason for that is that with breathing, you're not breathing into someone's face or whatever. Now, coughing and sneezing, anything like that, really, really needs to be covered at all times. And if we sometimes catch a cough off guard and we cover it with our hands. Go wash your hands immediately or use hand gel, because it can spread. So it does spread from our hands. We know that from having unclean hands. So sometimes you're kept pretty darn busy keeping your hands clean, throughout all of this. And remember that the virus is not absorbed through your skin. It's absorbed through mucous membranes. So that's your eyes, nose, and mouth. So when you have your hands, you put them in your eyes, nose, or mouth to make sure that actually that you don't. That just is a habit that has to change. But that's the reason why we have you wear a mask. If someone does wear a mask, one that's personally made for them at home, which I think are kind of fun to look at and see the creativity with that even, it has to cover both your nose and your mouth. Just having it over your mouth isn't enough. It needs to cover your nose. And if you were actually expected to be close contact, such as our wonderful healthcare providers, you would wear a kind of a goggles, face shield, plastic shield, something like that, to keep it from getting into your eyes, keep that virus from getting into your eyes. Let's see. So we talked about social distancing and how important that is, and not congregating, even though that's hard and we want to, and we're kind of craving it even more and more. And when you're staying home, I also want you to think about, and this is something I need to do, is be intentional about getting exercise, because I have not. I had a friend that we exercised daily during the week, and it was really good for me, and that just ended a couple of weeks ago, and I have not picked it up since that time. And so my new goal for next week is to intentionally get up a little bit earlier, look at the YouTube person that I like to watch, Leslie Sansone, actually does a really good home walk kick programs, and Iowa Public Television does have our one gal early in the morning too that does a really nice job of stretching you out and helping you to stay healthier. So get the exercise intentionally, eat a balanced diet, and so like I was telling Craig, that actually all the goodies that I bought for my son are about gone. because they haven't gone anywhere, and so I've been eating them. So that's when they're gone, that'll be a blessing too. But don't do what I do. They're just there. And also get plenty of fluids. And fluids can be water, they can be part of your coffee, they can be, your pop or soda as other people call it. Avoid the alcohol because it just doesn't improve your health at all as far as that goes. I should say it that way. And not that we don't enjoy an adult beverage, but just make sure that's not the bulk of it. How's that sound? Let's see, I wanted to take a note here about cleaning. Make sure you're reading the labels. I know I've said that before, but it can be dangerous to use certain chemicals together and not having them diluted correctly. And good old plain soap and water. Your cleaner, it doesn't have to be necessarily a spray can of disinfectant. You can actually use a good, whatever you use, like Lysol or I can't think of the brand I use. But anyway, some kind of a cleaner you mix with water with soap and a cloth and go around and just hit those high-touch areas. That's what it's all about. Make sure when you're, I'm going to jump around here, so I apologize for that, but I want to make sure that if you're doing any Googling on the internet, which is a good way to find things, but also be sure you use credible sources. And remember that Iowa Department of Public Health and the Center for Disease Control those are credible sources. There's a few other ones, but those are the ones that I use. And remember that Facebook, as entertaining as it can be, can also not be your friend. So look at how you're feeling when you're on Facebook and make sure that you're being wise and setting limits on that too. Be intentional about your activity on Facebook and don't believe everything you read. Okay, pictures are cute, but don't believe everything you read. We talked about social distancing. If you're making someone uncomfortable, please back up. That's just something that we do as a human person. We respect someone's boundaries, and there's going to be some boundaries that are a little bit further away, and we have to respect that. Like I tell my friends, kiss, kiss, hug, hug, because that's really what you do. You don't touch even those people that you love. Now, if you're in a household, you live together, that's a different world. We realize that. It's all the other people around us. Even our grandchildren that are not in the home, we need to help protect them. And you have that responsibility to make sure that you do that, to help them and their families. Make choices and be deliberate and intentional with the choices that you're making. And I want to remind you, too, that patience and kindness are so important during this time. We have to give ourselves some slack. We have to understand that it's not easy to be in some of the places that we're at as far as our homes constantly, but be patient and kind. And I do know that I work from home, and the day just never ends working at home for me anyway. It just goes on. And now my plan is to be more intentional about saying this is the end of my day. But some things have to happen, I realize, with the job I have. But there's intentional, this is the end of my day, and try to step away from it for a little bit. And a nap doesn't hurt, because I like to nap. So anyway, going to the grocery store, that's where, eating right at home does start at the grocery store. And when people are shopping, give them their space, because we all want to head for the grapes or the blueberries, that type of thing. And stand back, give them their space to look, because you'll deserve the same time. People are wearing homemade masks. I was talking to you about that, and but even with the mask on, you still do social distancing, because those masks they're not made for viruses, but they're made to actually contain your breathing so other people aren't getting sick from you. Okay, that's really what it's all about. So they're not going to be something that protects you from everything at all. But they can still be fashionable and help other people actually feel a little bit more comfortable around you. But with those masks and gloves or whatever you're wearing, that is not, you still have to have social distancing with that. And grocery stores, I know there's some that have aisles marked, which lead you down a path so you don't have to pass another person side by side. And that's a nice idea, Sometimes when someone's in an aisle and you see they're kind of take up the space, just go down another aisle and go around to where you need to go, or go back. So that's that respect and kindness part of it all. And we know when we go to the meat counters, those can get kind of crowded because, you know, that's fun to do and pick out your meats or whatever, but stand back, and when your time is time to go up, you to place your order. That gives other people the space that they need. And some people are doing, I know you can't take in your own, see, I don't take in my own recyclable bags, and I believe that has stopped for right now. And also respect that our essential workers, which are people who are working in the nursing, well, actually nursing homes too, but in our grocery stores and our places that are essential services people. And I had one of the gals say to me that she was an essential person, and I thought that is so true, and she should say that and know that, and we respect that. And so we respect our space with her too. You know, we do cash, we do you know, credit card or debit card, however you pay for your groceries and stuff. And money has always been dirty, okay, as such. But we like to have some. And so when you're done handling your money, you know, use a hand sanitizer, wash your hands. Like I think I may have said, I was at the grocery store and I waited till I got clear home to wash my hands so I could touch my face and scratch something, because that's just what we have to do. We appreciate the little wipes that go around the carts and try not to abuse them, so there's plenty for all of us. And some people have the habit of wiping down their groceries, and you know, whatever. I would follow the guidelines in the CDC and the IDPH and what they consider necessary. If you feel like it's something you need to do, go for it. You know, I always tell people, actually, be intentional so you don't wish you had, okay? We know, like I said, the virus is not absorbed through the skin. It's from touching our eyes, nose, and mouth. Actually, I have people that are not able to leave their home, and then what do? Yes, there is ordering online, and I know there is grocery delivery. You have to call the grocery store to ask those questions and go online. Actually, going online will give you all kinds of information. And I have done some ordering online and intended on picking up, but guess what? They didn't have what I wanted. But that can happen. So you have to kind of change your plans sometimes. But ordering online keeps you out of the stores. Do not, I fail to say this, but do not go as a family to any place. You send one person who is well and not ill, and also the person should be someone who has the least risk factors as far as you know, health goes. You know, that you should send the person that has the least risk factors type of things, such as asthma and those types of things, because this is a time when you step up and you do those things for other people. And if you can get groceries for someone that really should not be going to the grocery store, I recommend that. And what I do with my one dear friend is, you know, you collect the money later type of thing, because it's kind of hand it over and step away and kiss, kiss, hug, hug, like I say, you know, so we can still enjoy each other but not risk anybody's health. I tell people that when you go outside your home, you can assume that everybody that you see has it. That's the way you should live. And they should assume the same thing about you. So if you can keep going along and keep working along and stay as safe as you can, including not going anyplace, that's what I do. I get out once a week. Just because I need stuff, but I do a lot of waving from my deck and, excuse me, on the bike trail, and so it's good social for me from a distance. Well, and also go outside and look at that moon, because it's been really, really nice and pretty. And I think, did I read that or heard on the weather that it's our only one for 2020 that's supposed to be that moon that's the closest that can be. So go out and take a peek at the moon and enjoy the green grass. And this is Easter, and it's a great, great time of year, a beautiful time of year. We're very blessed. And have a very nice Easter. And I'm not seeing my family at all. And we always have an Easter egg hunt, but next year. So take care. Thank you. Be safe. See you next time.